Well, thank you for coming back. It's Wednesday, the 13th of May. Now, I've got some interesting reports from different parts of the world today, and particularly we want to focus on the UK and the United States today, and we'll do some other countries if time allows. Now, first of all, there's something from China that's slightly concerning, and that's new cases in Wuhan. So Wuhan, of course, was the original global epicenter of the pandemic. And they've gone 35 days without any community transmission. So that's absolutely brilliant. 35 days without person-to-person spread in Wuhan in China, the original epicenter. But now they've got a cluster of 6 cases. Now, I don't know what it's based on, but there is a cluster of 6 cases. Now, it is concerning that it means that the virus is kind of still there from somewhere. Although I would imagine these are backflow cases, perhaps travellers from Russia, or travellers from other parts of the world, or travellers certainly from other parts of China. But it's good that they've maintained a high index of suspicion in Wuhan, and they've discovered these when there's only 6 cases. Of course, there could be a few more. Now, I'm not concerned because the Chinese are testing, tracing, isolating, just like we need to do, the TTI strategy. So I'm sure they will contain this outbreak. And it seems as if to make sure the Chinese are testing. Not yet. They're doing about 400,000 a day at the moment, but they've got plans to test 1 million people a day in Wuhan. Now, this is staggering that the Chinese can mobilise this amount of testing facility. Now, as far as I can tell, it's the antigen test for the virus itself. So this is going to supply an incredible snapshot of any infection that is in Wuhan, and I would expect it to be fairly low level, but they're certainly pushing the boat out on this one. And they're going to test all 11 million people in Wuhan. Quite incredible. So it's a pity that it's not going to be antibody testing as well, because if it was antibody testing, we'd know exactly how many people in Wuhan have had the infection, therefore we'd know exact death rates and all sorts of things like that. So the fact that it's not antibody testing, that it's antigen testing, makes me think that there might be some logistical problem with doing an antibody test on so many people. Whether it's the quality of the test or what, I don't know. It's certainly not the availability of medical staff to take blood. They can organise that in China, that's for sure. But anyway, that's what they're planning on doing. So I would expect that to show fairly low levels of current infection in Wuhan. But it will be interesting to see when that result comes out, hopefully in just a few weeks' time. Now, a couple of cities in northwest China, up near the Russian border, have had some more cases. 2 cities with 7 cases each. And again, they're testing, tracing and isolating. And I'm confident that that's not going to turn out to be another widespread outbreak. Almost certainly cases that have come over the border from Russia. Now, officially, the border between Russia and China is closed, but unofficially, of course, that might be a completely different story. So, Chinese, nicely on top of things, pity about the cover-up at the beginning. That could have aborted this entire pandemic if they'd addressed the initial problem with this level of ruthless efficiency. But glad to see it's happening now. Now, the United Kingdom, we're getting on for 250,000 official cases. We know it's way higher. The death rate obviously continues to climb, although the rate of increase is not as high as it was. But still, this cumulative figure keeps getting higher, obviously. Now, England's trickling back to work now. With social distancing and so social distancing as we go back to work. Now, I've been talking to some employers just this morning actually about making workplaces safe, and a lot of employers can do that. To me, one of the big weaknesses is travelling to work, it's commuting. Now, I don't live in London, but I saw some video from London this morning. And I would estimate that coming off a fairly busy commuter train, there was about 20-30% of people wearing masks. That's disappointing, and that means there will be more spread. We need to mandate mask wearing on public transport. Why that is not done, I have no idea. Anyway, we're allowed to spend as much time outside exercising as we want now, so that's good. Especially if we can get out in the sun and get some fresh air and some vitamin D. But we always have to maintain the social distancing. Just allowed out more than once a day for exercise. So now, theoretically, you can exercise all day if you want to. We're allowed to meet one other person. Now, I'm not saying this is encouraged, but we are allowed to do it. So, like if you're walking in the park and you saw a friend, then you can walk through the park with them as long as you're at least 2 meters apart, and I would recommend 3 or 4 meters apart. 2 meters is an absolute minimum. But if you meet a friend with their family, or a friend with his wife, or a wife with a husband or partner or whatever, then you can't walk with them because that will be 2 people from outside. Now, I know this sounds a bit arbitrary, but we have to have cut-offs somewhere. And you have that's where the cut-off is, so I'm happy with it. People are being encouraged to walk or cycle to work. Councils are being given the power to close off roads for cyclists, but do not seem to be doing so, which is a pity. So again, I saw some video from London this morning. We had cyclists on the same road as motorists. And this is why cycling's dangerous. So an awful lot more people would cycle and take electric bikes if we get some stretches of roads without cars. So I really think it's time to take some draconian action on that. Good for the environment as well. Because we don't want people getting knocked off their push bikes by cars, as happens unfortunately quite frequently. So I really hope that councils use the powers they've been given by the governments and close off certain roads to motorised traffic and only let push bikes, cycles down there and electric bikes. Or at least close off lanes to motorised traffic to make it safer for cyclists. And then I believe millions of us will cycle to work if we do that. Face masks are encouraged but not mandated. Big pity. There are going to be more cases in the UK now, and wearing face masks would reduce that number. I firmly believe if everyone wore a face mask to protect each other. Pity it's not happening. Now, Scotland, northern country in the UK. Population just under 5.5 million, so smallish population country. Nearly 14,000 confirmed cases. It's obviously higher. Quite a large number of deaths, I'm afraid. Over 3,000 deaths up to the 10th of May. And we know it's the 10th of May because their statistical data has come out just this morning. Now, cumulatively in Scotland, up till now, we believe that 43% of COVID deaths have occurred in care homes. It's a lot. Almost half cumulatively of deaths. That is still an estimate, however. It may turn out to be higher. And this, of course, is a serious indictment of any country. Now, Nicola Sturgeon was at pains to point out that this sort of proportion of deaths in care homes is roughly the same as what's been seen in other parts of Europe. Now, I was disappointed she did that because that was making a political case. She was doing it in a very quiet, underhand way, well, not underhand, but sly way, but didn't really need to do that. Okay, it might be compatible with other European countries, but it's still bad. And Scotland has had more time to prepare than Spain or Italy as well, so unfortunate. That we have that data from Scotland. We have some more data which is even worse. Not saying it's any better in England, but it really needs something that needs to be urgently addressed. Now it is being addressed, it is going down, but it's still not where we'd like it to be. Now, Scotland for the week 19. Now, the Scots are very good on their data. They publish almost a week earlier than we do in England. So, well, I say we, I mean I was born in Scotland, but never mind. So this is the week 4th to the 10th of May. And this is the site, so check it out for yourself. It's got quite some interesting information on it. Now, 91% of COVID deaths in April had at least one existing comorbidity. Dementia and ischemic heart disease were the two most common. And I've actually got a graphic that illustrates this, so let's look at that. Now, where are we? Yep. So, main pre-existing conditions of those who died with COVID-19. This is in April. This is for the month. This is for the whole month of April. For the whole month of April. So, Alzheimer's and dementia were the most common. Ischemic heart disease, the second. Chronic lower respiratory disease, the third. Cerebrovascular disease. Diseases of the urinary system, and no. Sorry, and no comorbidities was the was 9%. So that makes 91% of people did have these comorbidities. Now the total deaths in week 19 from all causes in Scotland were 1,434. Now the 5-year average for that week, for week 19, the 5-year average is 1,034. So there's 400 excess deaths in Scotland this year. So quite a significant increase in deaths for this year than they would expect. So 400 more than average for the week, excess deaths. Now this is interesting because the Scottish authorities are saying that 96% of these excess deaths were directly COVID related. In other words, there was a 4% increase in deaths that weren't COVID related. Were this 4% COVID deaths that weren't diagnosed as such, or were there other people who weren't treated because of the COVID pandemic? We don't know. But this number's a lot lower than the figure in England. So I suspect this figure in Scotland is wrong, or the figure in England is wrong, because I wouldn't expect them to be so different, but they are. So 400 excess deaths, most of those COVID related, according to the Scottish statisticians and epidemiologists. Now, this is good. That's 245 less. So there was over 600 excess deaths the week before, down to 400 now. So 245 less deaths than the week 18 than the week before. So the death rate is going down, which is good. The death rate's going down. Now, in week 19, it was estimated that 57% of COVID deaths occurred in care homes. So this is bad. In week 18, it was 60%. So this week 19, which week is it? It's the week ending the 10th of May. Then 57% of deaths were in care homes. Not a good statistic. And as we would expect, 76% of the total deaths for COVID-19 were over the age of 75. Roughly what we would expect there. Now, this was the graph for the total cumulative deaths in Scotland. Just here. No, I'm on the wrong screen, aren't I? Sorry. It's get there in a minute. It's that one, right? Okay, right. So this is the graph for the cumulative deaths involving COVID-19 in Scotland from the 16th of March through to the 10th of May. Now, we can see the cumulative number of deaths is going up, and without the lockdown measures, it would have increased much more sharply than this. Of that, I have no doubt, and how high it would have gone. It would have gone much higher without the lockdown measures. But with the lockdown measures, it's going down. To bring it down further, we need to test, trace, isolate. Now, I suspect it will keep going up a bit, but I'm hoping the slope of that line is going to level off. So instead of going up like that, I'm hoping it's going to sort of level off and go up more gradually like that. So if the measures are maintained, this is what we might expect. especially if we can do the test, treat, isolate as well. So are the number of deaths going to increase? I'm afraid so. Is the rate of increase going to be less? I do hope so. And then I would hope that this will eventually become a perfectly flat line, indicating that there are no additional deaths occurring from COVID-19. So that is the hope, that we get a flat line. Now, the Americas. Let's think about the Americas generally. And I've got another Scottish picture to show you first. Yeah, this one's quite interesting. Now on this one, this is the difference from 5-year average by underlying cause for this 1 week, this week 19 ending the 10th of May. Now, as you would expect, there's lots more deaths from COVID-19, of course. But there was 9 less deaths than cancer and 25 less deaths from respiratory disease. 7 more from circulatory disease, 26 from dementia, 17 from other causes. Now, I think basically these are just background noise fluctuations. I don't think these are particularly significant numbers. But you could argue that these people that died of the respiratory disease could have died anyway. So this could be the difference between people that die with and people that die from COVID-19. That's possible. But these are the numbers where COVID-19 was mentioned on the death certificate. But I don't think these numbers are particularly significant. They're low enough not to be significant because, as we know, the vast majority of the excess deaths in Scotland, according to the Scottish epidemiologists, were caused by the COVID-19. Now, moving on to the Americas. Now, South America, there's an increase in cases of dengue fever. Now, dengue fever is a particularly nasty viral infection. It's spread by mosquitoes. COVID-19 is not spread by mosquitoes, but dengue is. And the person that gets dengue gets a fever, and it's sometimes called break bone fever because you can get such extreme pain in the bones that people think their bones are broken. So it's horrible disease. And one of the nasty things about dengue is it needs to be kept under control because basically there's 4 types of dengue, and if you get one type of dengue, then you're not going to get that type of dengue again. But then if you get the other type of dengue, you get this immunological enhancement effect and you get it much worse and you get much sicker and your bones will be even more painful. So the fact that what seems to be happening here is that the normal control measures for dengue aren't being taken because of the COVID-19. So the amount of dengue is increasing. So that is a remarkably concerning side effect of this pandemic. Now, Chile. Make what you want of those numbers. They're the official numbers. But news from Santiago is saying that the health system is on the verge of collapse in Chile. So that is concerning. Now, Chile seems to be following the standard kind of pattern where there's outbreaks in the big city. So lots of cases in Santiago, but it's spreading out into the countryside now as well. And if the health service is pretty well on the verge of being overwhelmed now, and we've got weeks to go, it's weeks till we get to the peak. So what we drew before, we had these kind of graphs like this, where we had this line here as being the ability of the health service to cope. So what we've managed to do in the UK is we've managed to keep the cases down below this. That's what we've managed to do in the UK. So the health service are still able to cope. Now the situation in Chile looks like it's like this at the moment. So the cases have gone up and it looks like they're kind of there now. And unfortunately, it looks like they're going to simply break through that, and there'll be people that are ill who will not have access to healthcare provision. And this is what concerns me about different parts of the world. So let's suppose the death rate here was about 1% in the UK, and about 5% of these people here were critical. So that means the 5% that were critical were able to look after, and only 1% of those, and we say only 1%, 1% of those, 1% of those died. So that's still bad, but it's 1%. But without the care facility, all 5% could potentially die, and the case fatality rate could be 5%. Now, I hope I'm wrong in that simple logic, but that's what is concerning me, and I've seen no convincing argument against that, and we're weeks away from the peak. And I've used Chile there as an example, but we could well have used Brazil. It's much the same situation in many parts of Brazil. Now, still in the Americas, the United States. So cases in the United States now over 1.33 million. 82,000 deaths. Now, Bernie Sanders asked Dr. Fauci if he thought this could be underestimated by 50%, and Dr. Fauci wouldn't be drawn on the 50%, but he did say it could well be more than that. So that's the minimum deaths in the United States. It could be there's 100,000 deaths in the United States already. So Dr. Fauci agreed the death rate could be higher from people dying at home. And Dr. Fauci warned that reopening could cause a spike in cases, which is fairly obvious. Once that R0 becomes greater than 1, then we're going to get accelerated exponential spread again, I'm afraid. And that's a rough guess of where we're at in the United States just now. Let's hope it's less than 1.3. And Dr. Fauci's words, this might trigger an outbreak that could be difficult to control, could not be controlled. So in other words, Dr. Fauci is actually saying there could be an uncontrollable outbreak in the United States. That's concerning. He said that would lead to more suffering and death, and as well as that would have longer term economic problems. He also said it was a bridge too far to expect vaccines or therapeutics in time for the fall semester. So Dr. Fauci is not expecting therapeutics, drugs to cure the disease, or a vaccine by this fall, or autumn as we would say in England. Now, NCB News said there's a 72% in COVID cases in some areas. And they picked out Central City, Kentucky, Nashville, Tennessee, Des Moines, Iowa. So I'm afraid there's significant increases in cases in the United States, and that's going to be accelerated by the reopening that we're seeing. Hope I'm wrong, but that seems to reflect Dr. Fauci's thinking. Now, I saw the director of Dr. Redfield, the director of the Centre for Disease Control. He's been interviewed by a senator, and he said, because we've got these reopening strategies now in quite a few states, and the CDC has not published detailed guidance on reopening yet. And Dr. Redfield said the guidance is going to be out soon. But the reopening's happening now. It's not good. It's a definite ball dropping situation, isn't it? Now, going on to more bad news, I'm afraid. Paediatric multisystem inflammatory syndrome. Cases reported in Italy, the United States, and the UK. Now, CDC is preparing a release on COVID in children, so we look forward to that. We know these children get fever, rash, abdominal pain and organ involvement. And it seems to be, this paediatric multisystem inflammatory syndrome seems to be a delayed inflammatory effect of the condition. So most cases seem to happen sometime after a child's been infected. But of course, because children get very minor COVID disease as a whole, then you might not know that they've been infected. But they can get this post-infective multi-inflammatory syndrome. Now, it's still looking fairly rare. But there are suspected cases in 14 states now in the United States. 14 states. So definitely more cases popping up in the United States. Still fairly deficient data from other parts of the world, it has to be said. So let's hope the other countries in the world do come up with more data on this soon. But these are figures from Andrew Cuomo, the governor of New York State. And he says there's been 100 cases in New York State. 100 cases. Three of these children, tragically, have died. Now, these are the figures. 0 to 4-year-olds, 5 cases. So, 100 cases, so that's 5%, isn't it? 1 to 4-year-olds, 18%. 5 to 9-year-olds, 29%. 10 to 14-year-olds, 28%. So it looks like this is affecting largely the 1 to 14. It's affecting children, isn't it? Teenagers, 16%. 20 to 21, 4%. So if this is duplicated around the world, which there's no reason to suspect it won't be, unfortunately. At the moment, it's a bit of a mystery syndrome. Let's hope it goes away. But it does mean we could be looking at a higher death rate in children than the almost zero death rate we had been anticipating. So that is concerning. Now, I've got a few other countries to do there, but I think that's probably enough for your concentration span for now. Let's just look at some pictures. Now, these have been sent to me from Thailand. Yeah. So I've actually done a bit of I worked with Khmer refugees, lived in Thailand for a while, so it's this sort of a village Thai situation that's very familiar to me. So it's really quite humbling to see the watching videos there. That's it's brilliant. And now these ladies here run this village health centre. So apparently everyone in the village is going there every day, and they're getting the temperature checked every day, which is good. And I'm sure these ladies are giving proper public health advice on social distancing and all the advice we would expect on hand hygiene from the sanitizer there with that lady in the background. So delighted to receive that from Thailand, thank you. Now this is out of sequence. This is not Thailand. This is actually taken in Nairobi. Now these guys, obviously they're too close together, but what's happening here is that these are bags of food arriving at the station from these people's so these are bags of food here arriving at the station from these people's relatives, and they're being sent up from the countryside. So what normally happens is these people work in the city and send money home to the family in the villages. But now, because they can't work, the situation's reversed, and the family in the villages are having to send them food to keep these guys alive in the town. So quite a poignant picture there from Kenya, really. Now we're back to Thailand. So this is a checkpoint. People moving around have checkpoints and get their temperatures checked and presumably unnecessary journeys stopped. Again, this is the village health centre with the temperature check and the sanitizer, and they put my video on there to show me. So it's very, very kind of you. Again, this is the village health centre with the health workers seeing their villagers every morning, which is excellent. And this lady here getting a temperature checked. So there we go. Thailand has impressed me greatly, actually. Now, the data from there is incomplete, but it's looking like with fairly basic, simple measures that they have contained the worst of this pandemic. So that is remarkably encouraging. Let's hope it stays that way. Right, I think that's us for today. Let's just look at some viewers, without whom this whole exercise would be completely pointless. So that's Sandeep from Canada. Good to know you're watching in Canada, Sandeep. This is Sandy from London, with a vitamin D chart there in the background. Thank you for watching in London, Sandy. Appreciate that. Great to know you're watching. This is Sandy in Phoenix. These have come out in alphabetical order, obviously. So another Sandy in Phoenix. Do a good deed. Good idea, Sandy. Thank you. This is Satish in London. Got quite a few viewers in London, I'm pleased to say. Good to know you're watching in London. This is Scott in Texas. Seem to have quite a few viewers in Texas. It's excellent. Thank you for watching in Texas, Scott. This is Sharai in the US. Good to know you're watching. And taking vitamin D. Excellent. This is Shelley in Washington State. She's a bit in the dark there, but she is there, trust me. Good to know you're watching in Washington State, Shelley. I think this one speaks for itself. I think that is... I've got this down as Sherry, so I think that must... Trouble is, I'm not sure if that's... I must write down the dog's name separately. Very impolite not to get the right names. My apologies. Anyway, we know you're watching in US. This was nice. These are Siemens health engineers who are working on coronavirus tests. And now, where are they? I don't know where they are. Siemens health worker team, coronavirus 2 assay development team. That means they're working on tests. Anyway, great to see you guys. You'll all recognise who you are, no doubt. And thank you for sending that corporate picture in. I really appreciate that. These are the proper scientists that are actually going to work us out of this pandemic. So we appreciate what you're doing, guys. And we wish you every possible rapid success. This is So Deep in West Bengal, watching in India. Good to know people are watching in India. This is Suzanne in South Africa. Thanks for watching in South Africa. Homemade mask, I'm sure. This is, I think that's pronounced Xavier. And he's in Ghent. And he's clearly an expert in special effects. And Ghent, is, of course, is in Belgium. And good to know you're watching in Belgium. And that is us for today. Thank you.